When you're sick, your gut instinct may be to go to the emergency room, but there are plenty of times where going to an urgent care is actually the better option. So here to help us answer the question is Medical Director of Care Now Urgent Care, Dr. Mark Montano. So thanks so much for joining us, Doctor. We really appreciate it.
Oh, of course, Mackenzie. Glad to be here.
Absolutely. Well, first of all, tell us some of the examples of when to go to urgent care instead of the ER.
Boy, we really can see a wide variety of symptoms, diseases, and illnesses. So common colds, flu, sore throat, earache. We take care of rashes, minor fractures, a lot of things that you used to go to your old family medicine provider for, but now you are going to the urgent care.
Absolutely. I know you guys do a lot there. What should our viewers know about visiting urgent care centers and insurance coverage? Are the costs similar to an emergency room trip, or how does that work?
Actually, our costs are more similar to your primary care visit. So we have a much lower entry to receiving care than the emergency department. That's one of the reasons I think urgent care really has become successful. You get to see a provider on your schedule, and the costs are real similar to what you would pay when you're going to your primary care provider.
Absolutely. And I know you touched on this a little bit, but what are some of the services that you see most often at urgent care centers, or you encourage people to go to more specifically?
I would say the most common thing we see is the cough, cold, runny nose, flu-like symptoms. That really is one of those things that any day I come to work, I know I'm going to see that. But we also see minor lacerations, fractures that do not have bones sticking out. I don't mean to be too graphic. And then, other minor injuries, sprains, strains, things like that. In the summer, we may see more heat stroke. In the winter, we see a lot of those skiing injuries. So really, we see a wide variety of illnesses and diseases.
And what advice do you have for potential patients deciding where they should go for treatment? Why should they come to urgent care?
Yeah, well, good question. And I think the one thing I would stress is anything that appears to be life-threatening, you want to go immediately to the ER. So chest pain, shortness of breath, passing out for an unexplained reason, weakness or facial droopiness that is new, those things really need to be seen in the emergency department. Sometimes it can be really hard to know, is this something I can see my urgent care provider for, or do I need to go to the emergency department? Now, excluding some of those life threats, we are always there to evaluate you and help make the best decision. It's not uncommon that we'll have a patient come in and they're just not sure, should I've gone to the emergency department? So we will do an evaluation, and then based on the evaluation and the testing we can do in the urgent care, we may ask you to go to the emergency department for that higher level of care.
Absolutely. That's great to know that you guys kind of help people guide what's best. Is there anything we haven't touched on that you want our viewers to know about urgent care?
Well, I think the main thing is if you're not sure, we're there to help. That is really our job. We see our job as taking care of you when we can and making sure you get to the care that you need, even if that's a specialist in the next couple of days or the emergency department immediately.
Absolutely, and we appreciate that. And thanks so much for joining us, Doctor, with all that important information. We really appreciate it.
Well, thanks for having me. Appreciate it.
Absolutely, and we'll be right back.